Over the years, I've had quite a few obstetricians refer patients to me. And many people that come in here go, why would you ever need to treat a pregnant woman? I can't think of a condition that a woman ever goes through or a process that ever changes a woman's body more than being pregnant. In 9 months, they put on 20 pounds plus usually, and their whole body frame changes. It requires different muscles to be developed, and they kind of morph. They morph into a whole different person, but they have to adapt to carrying this child and doing normal things. Most women will take and have a tough pregnancy and have pain. Back pain is considered pretty normal thing when you're pregnant, according to obstetricians. And the problem with that is that when you take and have back pain, most of the time in a woman, if she maintained her adaptability through that pregnancy. What do I mean by adaptability? Well, we have to make sure that every vertebra has 4 facet joints, 2 above and 2 below. Those are the joints that allow the movement pattern of the spine. They determine how it moves. And when you take and produce more weight on a woman's body, their muscles start to tighten up to hold up the additional weight. As it does that, it takes and starts bending the spine backwards, and the facet joints get closer and closer together. As they do that, then that makes the nerve endings in the facet joints, or those joint surfaces, they start rubbing and they start to hurt. And then the body will take and heal it just like anybody else, because you heal even when you're pregnant. And the body will take and lay down little fibrin in that joint and try to protect it. Now, they might start out with 5% loss of movement with an adhesion in that joint or a fixation. Over a week's time, it might go up to 10%. Pretty soon, they'll have enough loss of one joint movement that the joint then starts to require more movement from another joint, which now we have a problem because now it's working too hard, and so it's overused, and that normally starts creating more pain. So a chiropractor will take and adjust a woman by taking and laying her down, and this is after assessing, but we can't take x-rays on pregnant women. So we if they're not established, then we would have to do that without any kind of x-ray. But thorough examination, we take and lay them down, and we'll take and open up those joints so they become adaptable again. And when they become adaptable, then all of a sudden they start gliding and sliding. And of course, we know that over the 9 months, it's not going to stop until it's done, until the baby is delivered. So by the time usually a woman has gone through her 9 months, they all have swaybacks. They all have lordosis that are through the roof because they're bending back to hold up this weight here. And as they do that, if we can get them to stretch through that pregnancy, then they do a better job of maintaining it. And the nice thing about human bodies is in the 3rd trimester, the women's bodies normally make a relaxin hormone. The relaxin hormone takes in and loosens the ligaments and gets them ready for the baby to go through the birth canal. Then they have a problem with sometimes being too sloppy. Now all of a sudden they can't hold position very well. So those women, then they have too much movement in some joints. Then sometimes we have to put a belt around them to take and stabilize their pelvis to make it so it doesn't move quite so much. When Stephen was born, I had a doctor who is an obstetrician right across the parking lot in our medical complex here, who would send patients over, and they wouldn't want to take and go through being induced to have the baby. And so if a body is ready to have a baby, there's an area of the spine neurologically that sometimes, like in his mother's case, she wanted the baby to be a week early, just like his brother was born, and it didn't happen soon enough. So I went home and I adjusted Julie, and we ended up having him because it was time. The body doesn't do it unless it's ready. We had him at that time, and that helped her through pregnancy too, because it allowed her to not have to carry the baby too long. But All in all, pregnancy is one of those things that is very dynamic as far as feeling good if you can take and maintain adaptability through that pregnancy. Also nutrition, right, Dr. Hill?
Yeah, to hit on the functional aspect of the spine, when I think about pregnancy, it makes sense, right? A woman goes through a slow, gradual change for a 9-month period. Obviously, as stated a second ago, gaining weight through that process because baby is growing, and all of the weight that's being gained is in the front of the body. Over that period of time, the muscles in the back of the spine primarily are the ones that have to take the brunt of that. They get stronger and they get tighter for the most part, unless they're dealt with through that process through chiropractic care. And then the really interesting part about it, and the thing that I've seen very often in clinic or in clinical practice, is that the day that the mother has the baby, everything changes in an instant, right? They no longer have that gradual change going from no weight to full weight baby. Now it goes the opposite direction. They have a large baby in their stomach and they give birth to that baby, and now all of that weight is gone. And in an instant, the muscles that once had to hold up all of that weight are now in a different dynamic. So it's not uncommon that I see mothers that have just given birth be in need of chiropractic care to ease the burden on that situation that happens very quickly. So yeah, both ends of the spectrum of chiropractic care can be very effective at helping not just the gradual growing baby, but after the birth has happened, the recovery process.